Hi, this is Dr. Stephen Bracci. The art and harmony in fillers is using a combination of fillers to get the results, but you have to understand what fillers are, how they're injected, where they go, and the results that they cause. The key, however, is the skill of the provider and the expertise of their knowledge of the fillers and their aesthetic understanding of the harmony of the face. Basically, your face is supported by different tissues. So the softest tissue in the face is fat. That gives you a plumping and lifting. However, intermediate firmness tissue in the face is muscle, collagen, elastin, nerves. They're somewhere in between. And the firmest tissues on the face are bone and teeth. So we need to replicate a harmony of these different tissues to get you the best results depending on your age, depending on the correction we're trying to do, and it depends on the results we're trying to achieve. So basically, I use customized treatments wherever I'm doing fillers. A good example is the under eye area. That's my iRise technique. Basically, I'll use a combination of fillers. I use a softer filler closest to the eye called Bolotero. It's a hyaluronic acid in small amounts, and then I rely mainly on a firmer filler called Radius that gives you a bony lifting in the deeper tissues to harmonize that soft filler. So I use a combination of fillers, and that goes along for filling around the mouth and into the lips. I use a combination of fillers. So let's talk about the different types of fillers. The hyaluronic acid fillers are the soft fillers. They're easy to inject. They're ideal for lips, and they're good for, as I mentioned, under eye treatments. However, if you use more than a little bit of those soft fillers, you tend to hold too much water and you get puffy. Now, the intermediate type of filler is Sculptra. Sculptra is a great product. It works as a seed. It stimulates your own collagen production, which gives you lifting and support. The firmest filler on the market is Radius, and I love Radius. The reason why this is such a good product, because it does give you that firmy, bony-like contouring, and it also does stimulate collagen and elastin. So it has both the firm elements, and it has the intermediate elements of fillers. So it's a great product, and it's one of the most utilized in my practice. So basically, we have to be cognizant. So certain people have different needs. Bodybuilders, for example, they have muscle and they have bone, but they don't have a lot of fat. So because they've wasted all their fat away, so they would benefit from more a collagen stimulator like Sculptra. However, elderly people who have lost a lot of bone would benefit more from something that's firmer like Radius. So you have to understand what you're treating, the type of anatomy, and the type of person and the results you're trying to do. So younger people, however, they often go and get too much of the soft fillers, hyaluronic acid fillers. And the advantage for them is they're easy, they're less expensive, and a lot of providers provide them. But those fillers are notorious for making people puffy because they hold too much water. So I tend to use those soft fillers, as I mentioned, in very small quantities. So in summary, the key to all these filler treatments is having somebody who's an expert who knows how to use combinations of fillers in different modes, in different areas of the face to basically create a harmony that makes you lifted, supported, and the key is natural.